I was in a restaurant and I literally couldn't walk. I couldn't move. I was rushed to emergency.
Severe, severe pain, like I was being stabbed on the inside, my guts were being ripped out. That's what I felt like every time.
I remember I used to go to the clinic at some point with different pains, not even related to, because it got to a point, the pain was not just during menses.
1 in 10 women battle a silent adversary, a chronic inflammatory disease that disrupts lives and dreams, a condition hidden in plain sight, endometriosis.
So endometriosis, we consider it a systemic condition.
It's a condition in which endometrium-like tissue is growing outside the uterus.
Call them either lesions or nodules. They have different names that we can refer these lesions.
It is many times progressive. It is inflammatory. It is something that has fibrosis in its component.
And in what situation we can find endometriosis spreading to distant organ like the diaphragm, crosses the abdominal cavity to the chest cavity.
A benign disease with radical behavior, endometriosis affects multiple organs. As its etymology is unknown and postulated to various theories, it can be difficult to diagnose.
So in one case, one scenario, one theory of retrograde menstruation, menstruating backwards could work. But in another theory, like if it's in the diaphragm area, that doesn't work. So you have to look of coelomic metaplasia. So there are different theories, and that's why it's not very well understood.
So they'll have pain that is excruciating, that is affecting their day-to-day activities. These are symptoms that will have them skip schools, affect their productivity, and so on. Interestingly enough, we also find that the pain is not only during menstrual period. It can be, remote or off from the period. So just this pain, heaviness of the pelvis.
The average time from symptoms to diagnosis, even in high-income countries, is 4 to 11 years. This delay can be partly caused by the normalization of pain.
It took me 33 years to get my diagnosis. 33 years. I lived without knowing that I had endometriosis.
I was diagnosed with endometriosis in 2004, almost a 10 to 12 year delay, which is a very common thing for endometriosis patients. I started my period at the age of 13. I'm now 44 years old.
Okay, I think I was about 21 when I was diagnosed. I seen probably about 4 different gynecologists to get to the bottom of it.
We are normally told during your menses, everything is normal or the pain is normal. You'll bleed normal. We don't have markers, so you don't know what normal is.
The normalization of painful periods has been exacerbated by the lack of awareness surrounding endometriosis. This has led to posing a challenge to patients when it comes to accessing healthcare.
So you find the ratio, if I would say the ratio of patients who have endometriosis and specialists who are skilled in endometriosis, it's terrible.
And that's why you will hear very many stories of women who've actually traveled abroad in the past to have these surgeries done. I think now I can boldly say we can handle any kind of endometriosis in this country at our center because it's an endometriosis center.
Endometriosis, as much as we say it's not just a physical or a mental condition, it impacts your financial status because it's a very expensive illness which is not mostly covered by insurance companies.
One of the drugs, GnRH drugs that's used for treating women with endometriosis, called Zoladex. It's also a drug that's used for cancer. Now, if you're a cancer patient, you'll get that treatment for free. Oh, but if you say it's endometriosis, you have to pay for that same treatment for that same drug.
Endometriosis surgery can be very expensive, and the reason it's very expensive is because it can be very prolonged. It can be a long surgery. It can involve more than a certain number of experts, and all of them obviously would have a fee. and it would involve sometimes, let's say bowel surgery would involve equipment used or things used, let's say for bowel, reconstruction after you've removed a nodule from it, and we use staplers to make sure it's safe and to prevent leakages. And each of these staplers is a single-use instrument, and it's extremely expensive.
Endometriosis not only takes a physical toll on a person, but a mental toll as well. Studies have shown that 43.1% of women diagnosed with endometriosis have reported a range of mental health effects.
We are now seeing a lot of mental health issues due to endometriosis. I mean, if you have to live with this, recurrent pain without diagnosis, it's stressful.
I've faced women reaching the extent of suicidal tendencies. I've had women most of these women with chronic pain are on actually antidepressants. So it's not fun.
I'd just be scared. I'd be in tears every time I knew my period was coming, because I'm like, what's this one going to be like? Am I going to be hospitalized? Am I going to be in the fetal position in my bedroom for the next 7 to 12 days?
You sit and ask yourself, okay, why me?
What is going on? How do I deal with it? Seek professional help. I had to do a lot of counseling. There is nothing wrong and there is no shame in seeking medical help for your mental health.
Menstruation is considered personal in many cultures around the world. This means that women do not feel free to speak about anything abnormal that may be happening with their cycle. This, coupled with myths and misconceptions, lead to a fear of stigmatization and diagnostic delay.
Culture. It's been a problem, it's a barrier, and I think it's going to take some time for us to get rid of this part. When our elder women tell our younger girls, that pain is normal.
Being told that, you have painful periods, get over it, it's just a normal menstrual thing. Parents are told that I have it, my mother had it, my grandmother had it, you have it, so deal with it.
And when our culture tells us not to seek advice or something like that because our elders have faced the similar problems and they never went to the doctors.
That notion that you see a gynecologist when you are pregnant or when you have a baby, we need to just move away from that.
This culture barrier has to be stopped. And I think with education, we can easily clear that part of it.
Other challenges would be the myth that surrounds endometriosis, the misconception around endometriosis.
Pregnancy is a cure. Pregnancy is not a cure, all right? Pregnancy may slow it down, and once you get pregnant and you deliver, it might restart and continue growing.
How endometriosis used to be a Caucasian disease, which is not true because, we live in Kenya, we live in Africa, look at how many cases we have.
Now that I have endometriosis, I cannot get pregnant. That's a myth. Every woman with endometriosis should ideally be able to get pregnant. The only issue is seek advice, get the right treatment at the right time, don't delay too much.
Some people think it's not that endometriosis doesn't really exist, that this is a curse of some sort.
Endometriosis only affects the reproductive age group, all right? So a certain age bandwidth. Yes, majority are there, but it doesn't mean that a woman who is postmenopausal cannot develop or cannot progress getting endometriosis.
Currently, there is no known way to prevent endometriosis. However, early detection and management of the disease can help slow down its progression and help manage long-term symptoms. Treatments vary based on pregnancy desire and the severity of the condition, and ranges from holistic approaches to medications and surgeries.
The gold standard for diagnosis of endometriosis, at least for now, is laparoscopy. And laparoscopy is where we introduce a camera through the belly, and then we are able to visualize around the pelvis. And with the right skill, you're able to pick up these lesions.
The imaging of choice now is a transvaginal scan in any girl or woman who is now already sexually active. So you can do it transvaginally, and we can say that pretty much almost to 95 to 100% accuracy, we can pick up diagnosis of endometriosis. In those who are still younger and in places where there is not an advanced specific directed ultrasound transvaginally done for endometriosis, MRI still plays a major role.
Now, when we talk about treatment of endometriosis, medical, expectant management or surgery, it has to be very clear. The gold standard for management of endometriosis is excision of the lesion or the endometriotic node.
And another aspect about endometriosis is, endometrial surgery is always laparoscopic. There is no role for open surgery. So hysterectomy is not a treatment for endometriosis, but it's important to know that hysterectomy helps in one way in such women because that pelvis is so messed up. So when you clear it, you have a much bigger space to clear the rest of the endometriosis. That could be on the bowel, on the side walls, on the pelvic walls, on the parametrium, on the bladder. So when the uterus is out, that will help. Secondly, is many times endometriosis is actually coexisting with a condition we call adenomyosis. Now, adenomyosis is like the sister of endometriosis because it's also endometrium-like tissue growing where it should not be growing. But in this case, in adenomyosis, it's growing within the muscle of the uterus, whereas in endometriosis, it's going outside the uterus. So they are both similar and they present similarly as well.
When we give then other option of treatment is either we are suppressing the symptoms and hopefully will suppress the nodule.
We have progesterone receptor modulators. We have GnRH analogs that have been used in the past, but the limitation is the duration can only be for a certain period because of its side effects and its effect on the bone, which is negative.
We could start patients on pain medication. And pain medication will be medication we call the NSAIDs, so ibuprofen and so on.
Hormonal treatment, which actually can be used a bit long term. So we have certain progesterone hormones like desogestrel, which we can actually, Dynogest, which can actually be used for longer periods. Or you could use the combined pill.
So I'm on one of the strongest doses, strongest estrogen doses. I believe it's called Normin 1. And, it regulates my periods.
So I took Vicene. Initially, at that time, we were being advised to take it for a constant 6 months. Then you pause, you get to see where you are. So for me, I can say my body responded well.
We also have complementary and alternative medicine. So this includes things like acupressure, acupuncture. We have naturopathy. We have some medication, some drugs. Some dietary changes that actually help.
So I basically started changing my diet. I ruled out a lot of allergies. I was allergic to a lot of foods. So I started doing acupuncture over here. I've done 44 sessions of acupuncture. I was taking medication that is Chinese medicine.
Several studies suggest that a rise in endometriosis cases has been noted, especially in women of younger age groups. Raising awareness about the disease helps us identify those at risk, empower them, and help them manage the disease effectively.
Education and awareness is the best way to handle this disease.
What we've really tried to do as Endo Sisters towards that is just ensure that there are books out there to help empower women and also our advocacy efforts and basic social support.
Things like debunking all these myths leads to a more and more better awareness approach in terms of empowering yourself as a patient for endometriosis.
Getting the awareness out there for these girls and making them feel comfortable enough to talk about it, I think is really important. It needs to be out there. People need to know it's real, and we suffer all the time.
If we have more people aware of this condition, and we start training and educating young girls about what a normal menstrual cycle is and what is not normal, they'll probably present much earlier and will pick up the disease much earlier, and hence it will be treated much better.
My hope is that with what we are doing, with creating awareness, talking about it, we're going to change the narrative.
The motto should just be pain is not normal.
Pain surrounding menses is not normal, should not be normalized.
It changes with us. It changes by empowering yourself. It changes by believing yourself. It changes by loving yourself.
So be informed, because your information, knowing this, can help you help somebody else.
All women and girls need and should be able to live a normal life.